talk about the follow-up after a patient gets through the acute phase of PE. This is an area that's near and dear to my heart, taking care of CTEP patients. I never want to miss a patient that gets CTEP. Thankfully, most patients with PE don't end up with CTEP. But Mark, I was hoping you could tell us what the guidelines recommend in terms of post-PE follow-up and longer-term management.
First, I'll say this is a guideline on the management of acute PE, but we do talk about following these patients and knowing what to do if they have clinical findings suggestive of chronic thromboembolic pulmonary disease and CTEPH in particular. We recommend that at least within the first week of discharge, somebody talk to the patient just to make sure the patient understands what happens, understands what a pulmonary embolism has been placed on therapy and knows the therapy that they're on and they're taking it. Then we think the patient needs to be have a eyes-on visit at or before 3 months following the diagnosis. Again, review how things are going, see how the patient's feeling, assess for persistent PE symptoms, decide whether any additional testing is needed, and then to discuss the duration of anticoagulation. We're moving into your area of expertise, patients who have persistent symptoms, and some of them will go on to develop CTEPD or CTEPH in particular. We do recommend that once you're considering CTEPD, you send them to someone who knows really how to best manage these patients like yourself. For those who are on extended anticoagulation, we recommend periodic reassessment to see how they're doing. That can be done by a specialist or certainly if the primary care physician is comfortable with the patient's primary care physician.